Hi, and welcome to Business Access Report Health Edition. I'm your host, Kehila Hedayatsadeh. Americans 50 plus realize the importance of oral health, but aren't necessarily taking the steps to prioritize it. Joining us now to talk more on this topic is Sarah Shavaria. She's the president of Delta Dental Insurance Companies. Sarah, great to see you again. I appreciate you being here with us today.
Thank you. Thank you for having me.
Wonderful. So what did your research find in terms of how older Americans view their oral health habits and behaviors?
So let's start with there is a connection between oral health and overall health. And so we surveyed Americans 50 and older. And what we found was that 72% of them said that they wish they would have taken better care of their teeth and mouth when they were younger. And 80% of them are not. They are not going to the dentist twice a year like they should.
That's pretty striking. So what are the main barriers to prioritizing oral health? And are there certain communities that face proportionate barriers?
So we found three main barriers. The first is just this lack of understanding about this connection. And let me drop a statistic here because I think this is really important. For people 65 and older, 68% have gum disease. And gum disease can be an indicator for diabetes, heart disease, and even Alzheimer's. So we have to pay attention to that. The second is access to care. So think about time, transportation, their own mobility. And then the third barrier is a negative perception of going to the dentist, maybe related to when they went when they were younger, maybe related to their imagination, or maybe related to a story. And absolutely, we see the gap widen when we think about our Hispanic and Latino communities, or we think about our African or Black Americans. Those barriers are real.
Those are challenging barriers. Overall, what can people do to improve their oral health?
So we subscribe to the 2-1-2. So brush twice daily, floss once a day. I know you don't want to, but it's really important. And get to the dentist for that cleaning and that checkup twice a year. And then there are things we can do at home, like make sure you're drinking a lot of water if you can. Make sure it has fluoride. Eat healthy snacks, fruits, vegetables. Get some exercise. It's good for our overall health and our well-being. Go for a walk, a bike ride. And then finally, if you've got a partial or a denture, make sure you're taking that out at least once a day and cleaning it, and give your mouth a break. Those are some things we can do just every day.
Thank you for that information, Sarah. Where can our viewers go to learn more?
So please go to ddins.co/healthy aging. We've curated lots of information there that supports what I've been talking about, supports the questions, and we've tried to put all of the information in one place for you.
Sarah Shavaria, president of Delta Dental Insurance Companies. Once again, thank you so much for being here with us today and for the great information.
Thank you. Thanks for having me. Have a great day.
You can find out more about this topic at businessaccessreport.com. And if you want to find out more about me, you can do so at KehilaHedayatsadeh.com. Thank you so much for being here.